Welcome to Planetary Health First, Mars Next. It is going to be an amazing journey today. Hope you're ready for liftoff. We are live now. Well, this is awesome. It is a great day today. We are here in the studio, Planetary Health First, Mars Next. We have a special guest, Alex. We're going to be jumping into all and everything he's done and doing. He has single-handedly, I don't know how many years ago, he'll get into all the details when we get into doing more of a deep dive. Of course, this is discussional. We're not scripted, but much of what we're going to be talking about today is his efforts with Young Health Leader Summit and Advancement League, also commonly known as YHLS. And so before we get going, I just wanted to just share a little bit of his, just a video, because a video is worth a million.
Is this the group of people that will help push us towards a healthier future?
Definitely.
Yes, of course. Yeah, definitely.
Absolutely.
Most definitely.
Yes, absolutely. I think we can be the catalyst for change. That starts with one conversation. And then that one conversation blooms into another one, and to not have the same things of yesterday, but really create a better future. Why am I here? I think it's incredible just to be around other young leaders that are looking to do something positive, especially within the healthcare landscape. I think we're all looking for ways to make a better tomorrow, and this is where we start those conversations.
Yeah, there are two words that are very directly related, but we oftentimes don't connect them, and it's hospital and hospitality. And you don't see them merge. And so when you think about that, now you think about the hospital experience in a totally different way.
So I attended this summit because one, it's the Young Health Leader Summit, and I'm a young person. A lot of times we see a lot of, misrepresentation when it comes to healthcare. Not a lot of people that look like us are involved in that conversation. Not a lot of young people, not a lot of people of color as well.
Tools and technologies to help people live like a healthier life and have like better cardiovascular outcomes. Kind of that's my trend. So we're starting to see lots of venture funding going to the space and things like that. So that's the part of healthcare I'm most excited about.
The biggest trend I'm probably following is health tech. Just watching the way the different tech industries have been stepping into the healthcare world. Now that we're working in conjunction with tech, we wouldn't be like 10 to 15 years behind them anymore, since we, have them working with us.
So in healthcare, we debate all the time, all the things, right? But I think no matter what happens today and no matter where the conversations take us, the real work of health and healthcare, I think, has already happened this morning.
So we always say here at the Advancement League that we bring together the kindest collection of healthcare talent, and we truly bring together the best community that you can find in health. Someone said it best: we have to change what we do, we have to change how we think, and we have to disrupt the way things currently are. So we're back in North Carolina for 2023, and we will see you there. It's happening. This is breaking news. This is breaking news.
Breaking news.
Yeah, so that's that.
Well, I don't know about you, but I'm pumped.
Well, that was a blessing. It's just watching it in replay, sort of recap, is just every single one of those people that we've been so blessed that fly across the country and visit in different cities and have attended Young Health Leader Summit are such good friends. And so it's just amazing to see how excited they are. So that was the 2023 version. We were back in North Carolina, had home field advantage for me. But 2024, we're headed to we'll say Messi and Miami in May are the three M's. So we're headed to Miami. Jeff Bezos just moved to Miami, said he loves Miami. So it feels like Miami definitely is having that not a movement or not a moment, but a movement. So Miami we're excited about.
I love M cubed. I love that. All right. So I think what would be great, Alex, you've done a lot of amazing things for being such a young healthcare leader, let's say. And I would love for you to just share a little bit about yourself. I think you would do it way better than I could ever. Just a minute or two before we get going into our topic today.
I was so fortunate to do an MHA, Master of Healthcare Administration, and Master of Public Health at the University of Utah, which really gave me my first foray into the healthcare technology space. They paired student inventors with business leaders. And so I was fortunate to work on the very first iteration of DoxyMe, DOXY.me, like DocSeeMe, an early telehealth platform. And so that really gave me that sort of first taste of healthcare's changing, and there's going to be more technology influence in these next 20 years than maybe has in the last 100. And so that led me to an administrative fellowship at Geisinger, which again, just as you look back and kind of connect the dots of a career, I was so fortunate. I was there. It was a 2-year administrative fellowship. And so for those that aren't familiar with administrative fellowships, it's a leadership development program within the hospital ecosystem. And just timing wise, we were there for the last year of Dr. Glenn Steele, who wrote the book like American Revolutionary Healthcare or whatever it was. And so just a very well-respected, well-regarded leader, built Geisinger into the powerhouse that it is. So got to see his last year. And then we're there for the first year of Dr. David Feinberg, another powerhouse leader, big vision, big personality. And so that was just a ton of fun. We were as administrative fellows, you're sort of wrapped up in the executive leadership, which is amazing from just a vantage point standpoint. And so we were in the very last president's staff meeting for Dr. Glenn Steele, us 3 fellows during that year. And then, so it's the top 15 or 20 executives throughout the Geisinger health system. And then we were in the very first president's staff of Dr. David Feinberg. And so that really gave just such an incredible vantage point early in my career of here's how real change is made, here's how relationships are built, here are sort of the movers and shakers of healthcare. And one thing we noticed as we went to events is that young people, and now I have quite a bit of graying hair and things. Dr. Feinberg actually ran into an event recently, and he said, at this point in our careers, we need to name it the Middle Age Summit instead of the Young Health Leader Summit. So maybe that's in the works. But the real blessing and incredible vantage point that we had at those Geisinger stages, as we went to events and things, we noticed that they're just young people and new ideas are often sent to like the last day of the conference and almost like across the street. It's like, here's the prime space and here's the prime main stage sessions. And then this young people track is sort of in that back corner and you'll have your little moment of fun. And we realized just there's so much opportunity to say, hey, these are great ideas. These are people that are starting companies. These are things that we need to know and need to do. We also noticed that there weren't, in some of our viewpoint, we would go to these events and eat the fancy dinners, wear our nicest suits, and then we would fly back to our home organizations and we'd be like, wait a minute, we didn't really do anything. We talked a lot, but there's a lot of healthcare challenges and we didn't really have the chance. And so a couple of things we did different is we said, young people are going to have the main stage. That's going to be front and center. We're going to listen to everyone's ideas and we're going to foster the environment. And so we'll pick spaces. We'll be really serious about casual dress code. We'll do some things to make it so it feels comfortable. And then we will start and end with impact. And so right from the beginning of all our events, we give back to local community organizations in whichever city that we're hosting them. And then at the end, we have this community impact competition where we actually partner with local organizations and send attendees out with cash into the local community to invest. And so that's been a ton of fun. And that sort of career journey of networking and building this community led me then to Blue Cross North Carolina, which is why we moved down to North Carolina, and then led me to the global technology leader in AI and analytics, SaaS, where I currently am.
Wow, that was awesome. Thank you so much for that backdrop. And what would you want to share? I know you were telling us about Young Health Leader Summit Advancement League. Go for it. Tell us about it. What is it? Give us this is your time to shine.
Appreciate that. The Young Health Leader Summit, there's a few things we do differently that I think obviously everyone has so many, there's just infinite opportunities from an event standpoint. And so where you spend your dollars, whether sponsorship dollars or attendance registration type dollars, you just have limited time. And so looking out at the event landscape, if you're trying to decide, why do I go to Young Health Leader Summit? There's a few things that we do differently. And we joke Young Health Leader Summit could easily be called Healthcare Friends Fest. We've just been so fortunate to attract incredible friends across the spectrum of ages and backgrounds and parts of the healthcare ecosystem. And so a couple things right from the start, we start and end with impact. And so whatever city you attend the Young Health Leader Summit in, you're going to feel good that, hey, I made a difference in that city while I was there. I contributed, I learned some things from a sort of boots on the ground type impact of, I was out in that local community and I was able to partner with different organizations and I was able to leave it better than I found it. That's one. Another one, I think I've mentioned this before, is just we're really intentional about that setting. It's very different if you're sitting in your nicest suit or your nicest dress and you have this formal name badge with all these ribbons on it, and you're sitting across from the chief medical officer of a big health system. Your interaction is just different than if you're sitting in an art gallery in shorts and a t-shirt and summertime and hanging out and talking like peers. And so that's where we've really chosen inspiring spaces. And so we have rented art galleries, we've gone to baseball stadiums, we've gone to really cool Airbnb type places. And so the setting really matters just from an energy level standpoint and from an inspiration standpoint. And then even on name badges. So our name badges, we leave blank. And so you register, you pick up your name badge and you write whatever you want on it. And that's actually been incredible. People will write oftentimes first name, sometimes first name, last name, organization, sometimes title, but very often we've also asked people to write sort of one thing you need from the conference or want to get out of it. And so we've had people write, my name's Melinda and I host a podcast. And so it was like, Melinda hosts a podcast, want guests. And that changes the dynamic and the interaction. You may not know she's the chief medical officer of some big organization. And so you treat her like a peer. You see, hey, you're looking for guests. I'd love to be a guest. Or, hey, I know these 3 people. And so just some of the intention that we've put behind how do you really create great friendships through an event. We have no booths. And so there's great sponsors. We've been so fortunate to attract incredible people, but they don't have sort of hallway booths or things. And so you really feel like, hey, I'm here, I'm committed to the people around me. We make plenty of time to get to know each other. We joke about the like awkward middle school dance. We actually lined up people one year on one. We just said, hey, everybody, we're going to split the room right here in this middle. Half of you go that side, half of you go that side. And then we literally had them walk towards each other. And we said, all right, the person across from you got to get their cell phone number. They're now responsible for the next 3 days of we have this event of your fun. And so we want them to check in, make sure you're going to the dinners, make sure you're hanging out. And so it's really fostered people stay together, they have dinner together, they hang out together. And so you're sort of all in it for a few days, which has been really tremendously rewarding.
I love what I'm hearing from you. What is that intentionality? I think there's such an uncomfortableness when people get into social gatherings. Like there's that awkwardness. And you've really intentionally you've actually heightened that opportunity, that nervousness, but you've actually created by design the fact with the name badges and the allowing people, because everyone's going for a purpose. And so that the leveling that everyone's equal and everyone has something and needs something, and you just get it out there, right out there in the way. I think that's just brilliant. And, I'm sure you can't patent some of those processes, but gosh, every conference.
Blank name badges.
Yeah. I love that. But can you get into some of these, like maybe one or two things that just was an absolute failure and that might have felt like a failure during it, but was like that aha, like, wow, this is really a great learning opportunity? Because I see when I'm hearing you talk that you are just sounding like you have a user design mindset. Let's try to think outside of the box. Is there one or two things that just was like, oh my gosh, but you've learned from it and gained from it?
Actually, I would definitely say name badges. So name badges, as much as we want to take credit for it, it's become this sort of magical thing, and people really enjoy it. It's fun to take the marker and write down your own name and what you want out of it, or put down sort of, people draw pictures. There's been smiley faces, all the things. And so as much as we want to take credit for that, really it was like cheapness, our own frugality the first year of like, shoot, we don't have name badges, but maybe we don't need them. Like and the first year it was 75 people or so. And so now that we've grown into the hundreds, the second year we were like, hey, it was awesome that we didn't have name badges. Like, it worked out really well. People really tried hard to remember each other's names. And the second year we were like, we'll do that again. And by day 2, people were like, shoot, I wish I could remember everyone's names, but now there's too many people here. And so it wasn't until year 3 that we were like, okay, blank name badges, at least give people a chance to write down what they want. But there's also a million other failures from a standpoint of just learning how to run an event, or learning how timing wise. And like you said, just trying to be intentional about creating friendships and creating deep, meaningful relationships. We've tweaked the model every year. Some years it started on a Wednesday. And so it was Wednesday, Thursday, Friday, and you sort of came in and had a 24-hour community impact competition at the end. But quite a few people, since you had to fly in on Tuesday, you'd stay Wednesday. A lot of people left Thursday. And so we've started to sort of tweak the model. We've done small group breakout sessions at different times during the event. We've started to learn sort of what's best from an energy perspective of, there are some real advantages to a main stage, sort of sit in the audience and reflect, and then go into a panel type discussion or a small group type discussion where you get to have the microphone and you get to talk and converse. And so there's been a ton of learnings along the way. We think we've hit a magic year 6, this will be in 2024. And so we're changing it to a Thursday and Friday. There's going to be a welcome sort of reception on a Wednesday night, but it'll make it real convenient for people to sort of come in, get a lot of value out of it, have 2 jam-packed days, and then get out, or stay and hang out and experience Miami and all the fun that it is. So we've definitely tweaked the model over time. Some of it you learn by just learning, and some of it you learn by trying to be intentional of, hey, this didn't work out as well as it could have, or feels like there were a few people that were left out of groups or things. How do we make sure that everyone's fully included?
So what do you do? I know you're really doing an amazing job with the inclusivity, with the young emerging leaders, but you have corporate. You definitely, you're not I mean, you have to keep this. How do you balance this different stakeholders?
Yeah, and that's what we joke about, that just magical mix of kindness, and we call it the kindness collection of healthcare talent that's been assembled. And so some is just real fortunate, I think, and we've gone back and forth sometimes on the naming, is I think there's a gut reaction that some healthcare executives have of the Young Health Leader Summit. You're just sending young people, especially hosting in Miami next year may hurt that reputation as well. It's like, oh, you're just headed to Miami with young people to party. But so far every year, I think so Young Health Leaders Summit by name attracts early careerists. And so you have some people going through MHA, MBA, MPH type master's level healthcare programs. You have very early first 5 or so years of a career saying, hey, I haven't been to an event like this, or I want to meet some of these other people. I want to be around my peers. And so you naturally attract those. And then you also naturally attract people that want the energy of young people, or that want the ideas, or want to attract them to their businesses. And so that's where I say that we've had this just magical mix. So you have the most senior level executives, the most sort of recognizable names in healthcare saying, I want these people to come to my business. I think you see the pictures or you see the videos and you're able to say, like, these are the people I want running my business units, whether now or a few years in the future. And so it's really been sort of 50-50, is 50% is early careers, both students and those first 5 years, whether it's on the technology side at a health tech startup, whether it's a hospital division, health plans, a little bit of pharma. So you have that 50% of those, and then you have 50% of sort of senior level executives across all ages that are, I want to be here, I want to hang out, I want to talk to people, I want to recruit people. And so from the corporate angle, I think that's you see it in the big tech world, is tech trends to go younger. Of if you capture an audience at an earlier age, you get to influence them for longer. And so the most valuable marketing demographic is that sort of 18 to 26 or 26 to 34 demographic. And so there's quite a few brands now that we've been fortunate to work with that are saying, we want to be part of the Young Health Leader Summit. You do awesome branding, you have an exciting thing going on, you have the exact people that we want to be attracting. And so we've seen that from like a recruiting tool standpoint.
Yeah, I would absolutely see that. And I think sometimes, unfortunate, I think there are conferences and events that are trying to get more fresh and real and less staid. But healthcare can be really drab and boring and plaid, or
Yeah.
you know. And so I naturally, just with the branding, and I don't know, but so much from your organization, and I hope to get down south to this one, you know, in Miami. Tell me what your vision is for this Miami, the 6th year, Ben, is it? Tell me what you'd love. Tell me what you would want to if that magic could happen, and what would that be?
Yeah, every year, we always say just every year is the best year. And so this past year was the best year. We're hoping Miami continues that trend. I think the biggest thing for us is just early stage career wise. I remember I had just the only vision that I had in my head of healthcare was being a hospital administrator. And so even though I had a little bit of foray into technology aspect, it felt like that was sort of like the side show, not the main show. And so my thought process was just, I'm going to do an administrative fellowship. I'm going to be a hospital executive, and I'm going to go through that pathway. And as I felt a little bit uncomfortable early in a career I started to think through, like, I don't know if this is the day-to-day job that I want. I don't know if I'm making the biggest impact that I can. I don't know that I'm serving patients and members and things in the way that I can. What else is there? It almost felt taboo to have that conversation. And I was being trained by a hospital CEO to be the hospital CEO. And so it felt like you can't go to your boss and be like, hey, I know I signed up for this program, but I don't want to do it anymore. And you can't really go to your family. At that point, I had a young child. We were in graduate school debt. And so you can't really go to your wife or significant other and be like, hey, I know we signed up for this career, but like, I don't want to do it anymore. And so there's just real challenges and real frustrations. And it's not talked about enough, but I think so many early careerists have those moments where you're like crying in a car, or you're just suffering sort of mentally in a real challenging, real life way of what's my path? How am I going to find enjoyment? What am I going to do? And so many of us have experienced those feelings and sentiments. And our vision for the Young Health Leader Summit is that you get a flavor of everyone. And so you get a little bit of flavor of, hey, this person started on a path somewhat similar to where I am right now, but now they work in pharma, and I've never even heard of this role or this job or this organization. And they seem super happy and they're doing really cool things. And I get to have a conversation in shorts and a t-shirt and talk to them about, hey, what's it really like? And so the real goal and the real magic is just, if you can one by one and then collectively have a group, foster the environment that helps people feel comfortable enough to say, hey, I'm really struggling with something at work. Maybe there's a different path for me. And they get a little bit of advice or a little bit of friendship to be able to impact their path and make them feel more confident in their journey. That's the ultimate win in Miami.
That is great. Let's talk a little bit about, you've been mentioning about the community impact competitions. You were kind of talking a little bit about that, because really we're in healthcare. We want to go into healthcare. We want to make a difference. And I think you were saying it very well. You weren't getting into healthcare. Just seems like sometimes it's all about money and revenue cycle. Yeah. You weren't touching all that. You know, there is some, you know, and so I think what you were sharing about energizing everyone who came into this profession, and there are some amazing people in this profession doing good. And so tell us more about this community impact and your competitions and how you guys are doing that.
Yeah, historically, the last 24 hours of the event, and so Thursday at noon until Friday at noon, or whichever day we pick of the week, we will actually put attendees into groups. And so you have this new group of strangers, essentially, about 10 people, and then we'll physically give each group cash that's brought by sponsors, which thank you. And so each group has a few $1,000s and 24 hours, and there's literally no rules. Our lives are so structured from a schooling standpoint and then from a work standpoint that we've said, if you just open up some of that mindset and opportunity to say, you've got no rules in these 24 hours, all we ask you to do is go out into this local community and spend the money, invest the money in a way that you think is going to make the most difference. And then you'll come back and have one of those pitch competitions, just a few minutes each group to say, here's where we spent the money, here's why we spent the money, here's why we think it makes such a big difference. And I would say that it's been absolutely incredible. The joke is I cry every single year holding the microphone just because the impact gets bigger, the real life stories of real significant change in people's lives because of just this 24 hours. And so I'd say there's two main lessons that we've learned from this. One is just, it doesn't take a lot of time, doesn't take a lot of people, and it doesn't take a lot of money to really be a blessing in someone else's life and to make a difference. And so the biggest takeaway is just, with a little bit of money, a little bit of time, and a new group of strangers, there's people that have done just absolutely incredible things. There's programs that are still going on from year one. And so they've created partnerships between local hospitals and local graduate program schools that are still ongoing. Every Veterans Day, there's a program in Orlando that's still happening, giving cards and delivering flowers and balloons to veterans in a hospital down in Orlando since year one. And so 6 years later. So in just 24 hours with a new group, a little bit of money, a little bit of time, you can do a lot. And that sparks a little bit of the idea in people's minds that, hey, I can go back to my home community and maybe I can stop by a nonprofit on my way home from work, or I can volunteer a little bit more hours or whatever it is. And so you learn that. And then the second thing that's been really incredibly valuable is just individual career path-wise. It's really interesting. And we've got a bunch of these incredible stories. Is if you're sitting in a group of 9 strangers, so you're the 10th person in this new group, you don't really know them, and you're given this envelope of cash and you're told, go spend this in a way that's going to make the most difference. It's incredible to see what people are willing to fight to make sure that money gets spent on. And so we've had hospital leaders sit there and say, like, I will fight this group. I'm just willing to put my voice, like, we have to spend the money on pediatric mental health. Like, the absolute most important thing we could be spending our time and money on is we have to find a local organization that's dealing with early childhood mental health. Mm-hmm. And then there's like that spark that goes off in their mind of like, shoot, I'm willing to really talk about this, tell people why it's so important. But in my day job, like, I don't do anything with pediatric mental health. Mm-hmm. And so we've seen real careers change after those 24 hours. They go back to their organization and either find ways to serve on committees or find ways to be involved, or they've left their organization altogether and said, I'm going to go join a pediatric mental health organization, whether it's a startup or established organization. And you come from that realization of, I actually have to put the dollars on the line. I have to put my expertise on the line to be able to figure out why we're going to spend this money. And so that's been just incredible to see the real impact and then to see the change that comes about in individual careers.
Wow. Well, right now, I imagine you're still filling up the agenda for Miami, right? I imagine there is a ton of planning. And so what if you could beacon out to the audience, if there is, let's just say millions of people that are going to be listening to this, or just even whoever, just one, right? One amazing.
No, knowing your show, it's closer to millions. For sure.
You know, right. But anyway, what would be your ask right now to elicit involvement with pre-planning, helping participate? If you could make that ask to individuals, I mean, already I imagine they're like, man, this is amazing. I want to be involved. But what would that ask be today?
I'd say 2 things. First is attendance. And so just showing up is like 95% of the battle. And we really call it the Healthcare Friends Fest, Young Health Leader Summit. And so don't self-select yourself out of it. We say it's for the young and young at heart. And so our ask is just, if you have, we call it the good vibes only feel. So if you're a person that's gonna give to others, if you've got energy to give or resources to give or advice to give, we'd love to have you at the Young Health Leader Summit. So no matter your age, background, part of the ecosystem that you're in, it's better when we're together. And so we need the real future of health is going to be created together. It's going to take all of us. There's not one sort of ownership part of the ecosystem that's going to be able to solve all of the incredible challenges that we have. And it truly is, healthcare is the challenge of our time. And so showing up and being there and being able to have some hard conversations and some fun at the same time, I think is going to be really important. So that's the first one. And then second one I would say is Miami is expensive. That's what we've learned is this is probably our first event outside of home court advantage since the pandemic. And so since real inflation has set in. And so just food costs for a couple hundred people and some of the fun costs, all of those things. We're so excited to bring people together, and we have incredible spaces. We found incredible places, people that are already committed. We'll launch our first sort of look at speakers and agenda in the next couple of weeks. And we have just absolutely incredible, from healthcare luminaries to current recognizable athletes for a health and sports section of the agenda that we're going to do, to incredible venture capitalists, to international attendees. We have just absolutely insane amount of kindness again, and sort of pomp and circumstance of the people that we've already started to attract, and that we'll be announcing soon. And so I'd say the second one, so first one's attendance, second one is probably sponsorship. There's also, we see a lot of, not backlash, but there's some thought process on what is the ROI of some of the big events or some niche events. There's always like, was our booth worth it? Did it attract the leads, or what sort of was it that we paid for? And so there's always the ideas of, hey, we'd love to sponsor in ways that get our product in front of people or let people know about it. And so we're always really interested in, come at us with your creative ideas. Like I said, we have no booth and no sort of exhibit hall. And so there's all sorts of ways to, hey, you're going to have a captive, interested, really excited to learn audience for 3 full days. There's got to be some ways. There's some ways that we have. So we have a sponsored deck that we can get you, but there's also ways that we'd love to say, what have you wanted to do in an event, and what would make it meaningful, and how would you get in front of this incredible group of people that are there because they want to be there versus their company sends them there, things. And so that self-selection of the group makes it really a magical mix of people. So if you can come and you can sponsor, we got you.
I love that. I love that opportunity that you're sharing, and the ways to do that. What is your goal? Do you have an attendees goal amount? I mean, is there I guess there's a maximum. Obviously you might, you can't have but so many. I don't know. Maybe you'll have, Woodstock. I don't know what they had as a goal, but what does that look like when you're planning?
Yeah, so every year has gotten bigger and bigger. Last year was the first year we hit over 200. I think this year we'll probably hit 250 to 500. There's going to be somewhere, I think we're already seeing early demand of now I think the bright yellow and bright pink branding has started to capture a few people. And then just when you hit a little bit bigger attendee numbers, there's just the network effect of, hey, I went to this and it's awesome, and I want you to come now. Or I brought one colleague last year, I want to bring 3 or 4 this year. And so definitely the best case scenario is we find more space and we pick a bigger place, and we have to shift a little bit, but we've been used to that and excited about that. So I think the more the merrier. It truly is going to take all of us. We also really are thoughtful about small group sessions and sort of everyone has a microphone, that feeling. And so if we have to figure out different ways to use the space to say, we still want you to rotate around and to have different discussion groups and things, we're going to be really very intentional about the format of the event. So you're not just sitting and listening to people on panels or discussions. You're going to be really part of the conversation and brought into it right from the beginning.
Yeah, it sounds like, of course, you're growing, but it's quality. It's more about quality and community and really value. How did you stumble upon this? What got you, like, when you look back, your childhood, who you are? I mean, obviously you're into sports. You don't just wear a soccer jersey because you're
no, this is bonus points for my wife. I'm actually only recently into soccer. This is bonus point. My wife is Brazilian, so I feel like wearing a Brazilian jersey around the house gets me a little extra love.
How are they this year? Are they good?
Yeah, that's something we shouldn't talk about.
Oh, okay.
They're struggling a little bit.
Okay. Well, I've gotten into soccer as well. My wife, she's from I mean, she's born in the States, but we root for Mexico. So
Awesome.
but anyway, soccer is amazing. I think it's one of the best sports to watch. I played it as a junior and coming along, and it's just great. I think. Well, I mean, there's 4 billion people jamming out during World Cup, you know.
Yeah, it truly is the
But I
world's
don't
game.
want to. Yeah, yeah. So tell me, I'm sorry. Going back to my question with you, like as you coming up, you know, your thought process, like how did you stumble upon creating this community when you look at who you are as an individual? Because usually those things kind of come back from how you're wired. I'd love to hear about that process.
Yeah, I appreciate that. So Antoine Williams, the other co-founder, and we sat down and were talking about that actually one day, of just sort of who we were as kids and sort of what part of our wiring maybe contributed to some of this. And so by one, there's a few learnings that we took away. One, I'm an extrovert, and so I get so much energy from people, and so I love being able to go meet new people. And so that's probably just part of my wiring. And then the second one, so when I think about that, I was the type that hosted a cookie Thursdays. So every Thursday night throughout high school, we had the same group of friends come over to my house. My mom would buy bless her heart, would buy gallons of milk, and we'd make chocolate chip cookies, and we'd play PlayStation and hang out. And so we just had this consistency of sort of shooting hoops in the driveway and eating junk food and hanging out. And so and then throughout college, we hosted a annual fish fry that's pretty legendary. We have, I had some college roommates who would manage a fishing lodge up in Alaska. And so that was their sort of summer job. And when they'd come home, they'd bring the like deep freezer freeze packs of some of the fish they caught. And so we'd host a beginning of school kickoff fish fry that got overwhelming and amazing, but was incredible. And then we'd host croquet on the lawn of the library every Sunday afternoon. So I think by nature, just always trying to bring people together. And Antoine, as we were talking about it, learned very much the same thing. It was his house that people were coming to during high school. It was him and his friends that were putting on the DJ parties and things in college. And so I think both of us by nature are definitely extroverted, want people around, want to bring them together. And then just the commitment to impact as well. I think that gratitude that both of us felt as very similar experiences of zero healthcare network, zero healthcare ideology. And so it was very much like hospital administration, here's the 3 roles, that's what healthcare is. And so as we've progressed in our career and as we've had some difficult conversations and things throughout the years with some of the people we count as mentors or different things, it's made us just so grateful that we've been able to navigate that and found ways to hopefully be impactful and find some happiness and things along the way. And so if we can contribute sort of the bringing people together and those difficult conversations and some of that sort of career path happiness pathway opportunities, I think that's been a driving force for both of us.
Well, this has been such a pleasure to have you on today. I can see you're an extrovert. I feel energized just from being on this. And I think there are things that only are possible by, you know, I imagine with the way you are wired, Alex and Anton, your co-founder on this. And I wish you guys continued success. And I'd like to think, I'm already trying to think, how can I help? How can I get involved with this? Sure, it doesn't hurt that it's in Miami. North Carolina's cool too, but something about a little more warm weather in Miami because it's starting to get cold, falls here. But really, I think the whole thing that this natural beacon that you have is that people want to be involved with something that matters. People want to be involved with something that's doing good, and we're social. You know, we're social, and I think it's loud and clear. Your organization facilitates, like at a really accessible, it's accessible. And sometimes these conferences, with they're big, they're corporate, they have the booths, I don't know. There's lots of them you go to, and they're just, you can't really have so I like the way you've designed it. I think that's really because of you and your co-founder. And so I thank you again for coming on today. Is there anything that you feel that you'd like to share that we might have missed off? Because I know you're doing other stuff. You're not just doing this 24/7. You got a family, you got sports you do, you got other things, you got work that you do, a day job other than this. And if while you're here for these next few minutes, is there anything that you'd like to have as a takeaway for our audience?
Yeah, very sweet of you to offer. The one thing that I would say is just there's someone out there, just like I was, just like others that I've been around throughout my healthcare career, that is struggling at any stage of your career. So it could be you're in graduate school and you're like, man, I got a lot of student debt, or I'm really worried about how this is going to work out, or I don't feel like I'm making the right life decision right now. Or you're 5 years into your career and you're saying, hey, my peers are getting promoted faster than I am, or I don't have the title that I want, or my salary doesn't reflect this. Or you're an executive. We get calls from hospital CEOs or health plan, really senior leaders that say, hey, it looks like I'm doing amazing on LinkedIn and I'm not really doing amazing in life, and I don't know what to do, and what should I do? And so the one thing that I would say is just the compounding effect of having a vision or a dream or a willingness to voice that you're frustrated right now, or that you're not in the place that you want to be, and looking for help through others can really make a huge difference. We talk about the compounding effect of 5 years now of Young Health Leader Summit. In year 1, we reached out to people that just didn't respond. Year 2, reached out to speakers, didn't respond. Year 3, it was like, okay, now you've reached out for me for 3 straight years. Here's the I'm busy, but I at least said I'm busy. Year 4, they actually came and spoke. Or year 4, they said they were busy too. Year 5, they came and spoke. Or they said, how can I support? How can I be in? So there's a real compounding effect to what you're doing. And so there's people that are in roles that aren't technology focused, and they're saying, hey, I really want to be part of the technology aspect of healthcare. Maybe it's not overnight, but if you start reading about technology, if you start asking people about technology, if you start going and shadowing people for a couple hours that have technology roles, your life can be so significantly different, whether it's tomorrow or 5 years from now or 15 years from now. We're all on that journey of how do we balance our personal and professional pursuits. And so I just really want to make an effort to say, what's happening right now to you, career-wise or personality-wise, or professionally or personally. What's happening to you right now doesn't reflect what may happen to you tomorrow. And so that's the ask for everyone too, is that's what I think some of the magic of the Young Health Leaders Summit is truly, is if you're some of the people who report to you, you may report to tomorrow. The drastic shift as you go through life and you see some people are going to get derailed by addiction or different challenges or health challenges. And some people are going to, some aspect of their personality and their pursuit is going to click in the right role. And they go from someone that isn't well respected one day to the main CEO tomorrow. And so just the way that we treat each other, with no importance to current title or position or place in life, is just so important, because you truly don't know what's going to happen tomorrow. And so the last thing I would leave is just, if you're struggling today, it doesn't mean you're going to be struggling tomorrow. And I'm absolutely rooting for you in all the ways that we can.
Well said. That I've received that, and I hope everyone else was. Words of wisdom from Alex today. Friends, it has been a great journey today on Planetary Health First, Mars Next. Follow us for more on Planetary Health First, Mars Next. Until next time, peace be with you.